Actually, Nita, would you mind talking a little bit about your organization? Okay, and we'll start with that.
All right. Okay. Hi, everyone. Well, thank you for not putting me on the spot to present because I wasn't ready for that. But my name is Nita Sinha. I've met many of you at our booth today at the Prevent Blindness booth, so thank you for stopping by. But I am the Director of Public Health at Prevent Blindness. And I am here actually to share some resources with you. That's why we have a booth today. But I just wanted to share a couple resources that we have, which I thought might be beneficial for all of you. You know, we've talked a lot about community today and having a patient voice. And, you know, at Prevent Blindness, we heard that from many patients and many folks. And we put together a program called the Aspect Patient Empowerment Program. And the Aspect program was really to bring that patient voice out for many of you, those who are living with glaucoma, but also living with any other eye diseases, and also for their allies, like parents, caregivers, also those who are also working in the health field. And this program was developed to really empower the patient to advocate for themselves at the eye doctor and also at their other health visits, to really empower and ask questions, get the treatment they need, decide if they want a second opinion. Also to empower themselves to tell their story and learn how to tell their story concisely and share that story to advocate for vision and eye health services for themselves, for others at the local level, state level, national level, but also to help use that voice to, graduates of the program have used their voice to help those who are developing technologies for those with low vision to make sure they're also accessible for them, for pharma and developing what they're working on and what's really important to the patient. So it's a great program. It's a 9 to 10 week program that happens every couple of weeks. So it's just something to be aware of. The other thing I wanted to share, and sorry, I won't be so long-winded.
No, it's wonderful.
Is that we have a a platform called the Glaucoma Community. And it is an online platform, but also it's an app on your phone if you look up the Glaucoma Community. I won't be offended if you're looking on your phones to look it up right now. But it's a free platform, and it provides 3 things that assist patients living with glaucoma, their caregivers, and even healthcare providers. One is it has a tailored news feed of all the information about glaucoma that's available on the web, but it's actually tailored to make sure it's relevant. It's been reviewed by a glaucoma specialist, and it's tailored to the topics and interests that you have. If it's living healthy, like was discussed on this panel, or treatments, eye medications, it'll be tailored to that information and specified for you. The other component, it has a community chat, which helps provide community and helps you share information about what you're going through or information that you find about glaucoma, or pose questions, not medical questions, but more about healthy living, anything that you've learned. And so you can respond to it, you can like it. It kind of is like the Facebook of this platform. And the last thing that it includes is it has a My Care section where you can keep all the information that you have about your glaucoma diagnosis, the treatments, the eye drops that you take, what surgeries you have, and keep that in one place. So that if you want to share it with your provider, you can email it, download it, and it's in a secure location, so you don't have to worry about keeping it there. So I just want to share those couple items with you, just to introduce myself. So sorry that was very long. But
no, that was great. There is a question here about any peer-to-peer patient advocate organizations. I'm going to just see if there's anything you want to add into that.
So just going back to the Aspect program, that group takes about 25 to 30 people per cohort, which happens twice a year. And you know, you're talking with others that are going through similar situations as yourself. And so you really get that camaraderie, and we've seen in the past couple of years as we've had that program, there's been some deep friendships that have occurred, and people have really gained knowledge about sharing their conditions with each other, but also just, learning that there's others who are dealing with the same situation as them.
That's wonderful. Thank you for sharing that. There's a question. So this is some of the questions coming up. I will open up to you guys. There's a question that has been in here, and I really want to address it. And you guys can chime in. I'll start with it, and then I have Dr. Simon Law and Dr. Lozano chime in. Being mixed race has influenced treatment recommendations for me. Can someone address some of the known differences due to racial background? I'll start with a few words and then you guys can take over, but that's a really important question because it is true. There are genetic components to this. Race plays a role. It is known that African Americans or Africans have a higher rate of glaucoma, that Latinos have a higher rate of glaucoma. There are studies done on this and it has shown it. So there is a different risk factor for different races. Is there anything you'd want to chime in, Dr. Law?
Oh, I agree. Not only that, there's not just genetic or there's a difference between different people, but also they talk about the accessibility, how the doctor treat the patient, what's the relationship between the doctors and the patients in a different racial background. Those makes a lot of difference. And it's important for us and also important for the public also, because we know there's certain risk factor and certain types of glaucoma. Glaucoma is not just one disease, but it's actually a basket, a waste basket of many, many, many glaucoma types. So there's some risk factor we know. African Americans, Asian, a different type of glaucoma, and Hispanic maybe another different type of glaucoma, age, pressure, and all these kind of things. So for the public to know there's a difference so they can seek help earlier and check to get a baseline earlier, or for the doctors to recommend the patients to see a doctor earlier, those are very important. Yeah, there's a difference.
So there is a difference, yes. Dr. Lozano?
I mean, I feel like every race has a different kind of glaucoma, so I think the most important here would be, since I call it the silent thief of sight, I would recommend getting your eyes checked, like when you're reach 40, and if you especially have glaucoma, just tell your family members, go get checked. Like if everything is normal, then you can really relax and then see yourself in a few years, but you can catch it early if you really get checked at age 40. I wouldn't wait until you're 70 and then you're diagnosed with glaucoma and it's already moderate to severe stage.
I just want to mention one more thing.
Yes.
Something that I found that, as we get older, getting philosophical, so sorry about that. Yesterday, I talked to the patients that I finally explained to him about was that he had his pseudoexfoliation glaucoma. I was so happy at the end of the conversation, at the end of the thing, that he voluntarily tell me that, thank you, I'm going to tell my family members about it. And sometimes he has a family history. They know nothing about the family history, even though they have a big family. People don't talk in the family. Mm-hmm. And this is talk about glaucoma, chronic disease. You need support. And how are you going to handle this by yourself when you're by yourself, alone? It's tough.
Yeah, very good point. Okay, we have a couple questions about, will swimming underwater increase the pressure for the eye? I'll direct that to Dr. Law.
Interesting thing, this is a Long Beach. So I think people probably in the audience is in the diving business. Just regular diving inside the pool, it's not going to change the pressure that much. Of course, you probably heard about the news that there's people died going down to the ocean to look for the Titanic. You go down, the pressure goes up, but the pressure is supposed to be involving you all parts of it, inside, outside. So it's not going to change anything, supposedly. Okay. Of course, I cannot study that because I'm not going to go down to check it. But the issue, what happened? The issue is because when you go all the way down deep, you wear a suit with a goggle. The goggle has a negative pressure inside in order to be a goggle. Otherwise, water seep in there and you lose the sight. You cannot see the water floating around. So you want the seal to suck in there, and when you go down, the pressure is high around you, but the pressure in the goggle is lower. So your eye pressure is higher, the goggle space is lower, so the pressure it becomes opposite thing, kind of eye pressure become higher. Now, still not a problem because that guy is not going to just go down not doing anything because he will breathe air into that goggle in order to feel good, because otherwise this suction is so painful. They will do it all the time. But of course, they don't go and blow it enough to the point that will lose the seal, because lose the seal, the water will go in there. So the experienced diver will counteract that, so it's not going to be a problem. The problem is when you have a glaucoma surgery, and some type of glaucoma surgery, theoretically. Because if you have a surgery, a traditional surgery, that creates a channel for the fluid to get out as a reservoir. The fluid can get to the outside to be absorbed to the rest of the body. If you go down, and if it's working too well, then the fluid will go to that place, meaning that the pressure inside the eye, the wall pressure drop and cause bleeding. So theoretically, again, that you can have a bleeding inside the eye, which is a very dangerous emergency in the depth of the ocean. And that's the only things people are concerned about.
Okay. Next question. I'm going to try to answer this one. Patient journey for the very common concomitant dry eye disease and glaucoma at the same time. How many of you guys have that? Dry eye and glaucoma? Probably. I mean, I want everybody to raise their hand because that's actually going to go hand in hand with them, with each other. How do you manage that? Which specialist do you go to when you have dry eye and glaucoma? I think I'll take a stab at this because I work in an office where I'm the glaucoma specialist. I do glaucoma and cataract. My partner, Dr. Nicole Fram, does cataract, refractive, and dry eye. So we happen to treat both in our clinic. We have a dry eye clinic and all of that. But I tend to see, those patients come in, and I think if you have severe dry eye where it's really bothering your daily function, that really needs to be addressed. And both the dry eye specialist and the glaucoma specialist have to work together because to some extent your drops are causing this. And so you may need to consider being off the drops and doing surgery or doing something different. And of course, there's a ton of dry eye therapy. It's not just artificial tears, but there's all kinds of things you can do for dry eye that kind of will help. So you can temper, it has to be from both angles. But being on glaucoma drops is really a risk factor for dry eye. And if that's really bothering you, then a discussion has to be said about that because I think it's important. You guys want to chime in, Dr.?
Yeah, I do want to add something. So typically when we say about glaucoma treatment, we like to say non-invasive and very invasive. And of course, non-invasive starts with drops, and then very invasive, it's like this really big surgeries like a trabeculectomy or a tube. But to me, I feel like glaucoma drops are invasive. I mean, you put that drop and you're like, get the burning, the irritation, like your eye feels terrible. So some patients like, this drop is actually hurting my eye. So we have a lot of technology right now where we have lasers and new minimally invasive glaucoma surgery where you don't have to wait until you try every single drop and they get the surgery because of the risks. Like, I think we're at that time where you can say, I'm done. It's reducing my quality of life. My grandkids are telling me my eyes look like crazy. I look like a Halloween person. Like, you really don't have to wait until that point. I think we do have the technology to go one step ahead and get that laser done, get that minimally invasive glaucoma surgery. I don't like to call myself an aggressive surgeon, but like when I see an eye and it's very red, like I really want to help the patient. With dry eye, it's like, okay, I put a drop, now I get the dry eye and I give you another drop. To me, that's not treatment. I'm like putting a Band-Aid on what I have. So I want to take that agent, remove that glaucoma medication, and do something else so that you don't have all those symptoms.
Yes, good. And then one last question for Anita. Sorry, can you please tell us about next month's Eye Summit?
Oh, well, thank you for
I think that
plugging
may have been planted by somebody, but I'm not sure.
So,
Was it her? Okay.
So Prevent Blindness has an annual Eye Summit. It's called the Focus on Eye Health Summit. And it used to be in Washington, D.C., but once COVID hit, it's become virtual. So we invite all of you to attend. I believe the website is eyesummit.vfairs.com. And so that's the place you can register. But the premise behind it is talking about different topical areas around vision and eye health, but on the kind of public health aspects of it. The second day of our event is focused on the mental wellness and vision and eye health. So really talking about how mental health is really important in vision and eye health. So I really encourage all of you to attend that. The first day we'll be talking about new advancements in eye care and how that affects the patient. That will be our keynote speaker, and we'll have a few other presentations, and that is on July 12th and 13th, and it's a virtual event, and it's free. So I invite you to join, and if you have any questions, come by the Prevent Blindness booth afterwards. It's ifairs.com, or I think it's .com.
If you didn't get that, Michelle, can we make sure that that information's emailed out for the iSummit next?
Thank you.
Yeah, thank you. Okay, thank you so much to our panelists.